So I'm Dr. Lina Vilar. We are going to talk about our case report of term stimulation. We did this case in Sidmar Clinic. Our clinic is in Mexico City. So the patient, her age is 37. Her menarche was at 12 years old. She doesn't have any pregnancy. Her AMH is 1.8, BMI 28.5. Her cycles are very regular of 28 days duration. Infertility of 2 years. So previously surgery of laparoscopic cholecystectomy, and gynecological is bilateral salpingectomy, yes. And her partner is 47 years old. And about the parameters, seminals was normal, only morphology a little low of 2%. So she had two cycles of IVF previously, the term stimulation. Her first cycle was at 35 years old. This cycle of IVF lasts duration of days 12 days. Total FSH use was 5,200 units of FSH. They retrieved 3 eggs in the cycle, fertilized 3 eggs also, and they have 3 embryos of day 3 of very low quality. They decided to transfer those embryos, and they didn't have any pregnancy. The second cycle was at 36 years old. In this cycle, the duration of the IVF was 12 days. The total FSH use was 3,600 units. We retrieved 2 eggs in this occasion, fertilized 2 eggs, but we didn't have any development of embryos. So we decided to make term stimulation this patient. So we started the medication the second day of her period, of the menstrual period of the cycle. We started with 300 units the first day, but we did decide to lower the medication. And the duration of the term stimulations of medication was 15 days. Additional, the first day of her period was the total of follicular phase 16 days. So sometimes we have to make coasting the day 9 of the cycle of the stimulation cycle and the 12th day. This because some in the follicles, in the right follicle and the left follicle, we have a few follicles bigger than others. So only to try to have a more mature follicles, we try to coasting sometimes, no? And we don't have more like a follicles bigger, so big than the others. And okay, so at day 13 we saw that we have already follicles of the size of 21, 19, 21 in the right ovary. In the left ovary we have 18, 22, 24, but we didn't decide to trigger that day. So we give it 2 days more, and at the 15th day of stimulation, FSH hormonal stimulation, we saw follicles of 25, 18, 20 in the right ovary, in the left ovary 15, 19, but we'd have, so that day we decide to trigger with HCG, and the results of this term stimulation in this patient with 2 IVF cycles that we didn't have blastocysts of good quality was this, oh my God, these results. So the summary of this cycle was the term stimulation, the duration follicular phase 16 days. The total FSH uses in these cycles was 2,100 units. We retrieved 8 eggs in this cycle. We have fertilized 8 eggs of this cycle and 5 blastocysts of good quality, 5 blastocyst stage of good quality. So this, we have the conclusion of this patient that in my experience with this case and several others that we are doing, the term stimulation improves the quality in desperately difficult cases. So term stimulations require more attention and expertise, but we can have very good results with these patients. Thank you.